Good to go.
Thank you. All right, everybody. Welcome. This is another session of the Integrating the Healthcare Enterprise webinar series for 2019. My name is Rob Wilder. I am a Senior Product Manager for Spoke, and I'm also an IHE Patient Care Device Planning Committee Co-Chair. I'll be presenting today on the patient care device domain. So as we get started, a little bit of history around patient care devices. The patient care device domain, or PCD as we call it, has been around since 2005 to address point-of-care device integration needs. The effort was initially defined to utilize open standards that would enable interoperable solutions for out-of-the-box integration capabilities. These standards can be used to easily implement and manage multiple systems within a healthcare enterprise, increase the return on investment for connected systems, and greatly diminish the cost of ownership over time with systems implementing these standards. The dominant standard, speaking of standards used, is HL7 version 2.6, with some incidental usage of versions 2.7 and 2.8 as well. Internationally, it should be noted, some lower levels of HL7 versions are also used, such as in Japan, where we've seen version 2.3 used with our profiles. For object models and nomenclature, it should be noted that PCD uses the IEEE 11073 standards for nomenclature and information models, and that'll also be referenced later on in the presentation. For output transmissions to endpoint devices, which are non-HL7 compliant, the PCD domain conforms to the Wireless Communications Transport Protocol, or WCTP, for transmission to and from mobile communication devices. This protocol is chosen since it was broadly accepted and established as a standard in the market that could easily be extended to serve the needs of IHE as we saw fit. Now, moving back to HL7, the PCD profiles use items from other domains when necessary as well, such as consistent time measurement, which is contained within the ITI domain. The IHE could not exist, of course, without our co-sponsor contributions from HIMSS, as well as the American College of Clinical Engineering and the Association for the Advancement of Medical Instrumentation, or AMI. So the next few slides will provide an overview of the purpose and focus of the patient care device domain. PCD drives standards for all types of patient health devices, from external or ancillary to implantable. The areas of focus can include collection or harmonization of data, patient association to devices, harmonization of terms and nomenclature that those devices use to communicate, the reporting of information about those devices for documentation or event notification purposes, or for the consumption on dashboards or mobile devices, and for the storing of data where needed to ensure safety as well. The PCD domain includes a number of different profiles within it. We're going to cover all of those here today. Before we go into detail, I can summarize each of them for overarching purpose. As we go through these, we'll also cover some supportive efforts of the profiles that ensure that they're being implemented properly and help them to work better in a live healthcare environment. So IDCO addresses communications and storage of data with implantable devices. DEC profile will cover the communications of important patient readings to their record. The ACM profile is going to cover communications of alerts from patient care devices and other healthcare systems to clinicians for tasks and actions related to the patient care. And along with general delivery of data alerts, both ACM and DEC profiles support the consumption of waveform data for patient records, and for records keeping or reporting, really. And for advanced content with delivery to clinical staff in the case of alerts. The MEM profile has two different areas of focus we're going to cover. The MEM with device management focuses on the equipment used in healthcare of the patient, because equipment needs to stay healthy too. And this will include delivery of content and upgrade management in conjunction with computerized maintenance management systems, or CMMS. MEM with location services will also be covered, and the focus there is on devices which provide a standard way of finding them for use, or in increased content with the delivery of event notifications. We have a few profiles that are involved in infusion management and device identity for all the patient care devices. PCIM represents point of care infusion management, and that one focuses on associating automatically collected medical device data reliably with patient information. This promotes the accuracy and completeness of medical device data in electronic medical records. We have some supportive efforts too, which have effect across the profiles and will be seen with some or all of the profiles in use. Some of the supportive efforts that can provide benefits in our efforts include Rosetta Terminology Mapping, or RTM as we call it, which makes use of IEEE standards to harmonize nomenclature, enumerations, units of measure, different things for all the systems conforming to the profiles. Optimized message syntax, or OMS, is also used for greater communications efficiency, and we'll cover that in more depth. And we'll do a coverage on the NIST testing tools that are used for validation and profile support within the domain. So now we'll get into a little bit more detail with each one of these profiles within the domain. DEC naturally is first. That was our first profile. That was launched in the PCD domain back at the incept. This profile has three actors. The Device Observation Reporter, or DOR, is the sending system in a transaction. The Device Observation Consumer is the receiving system within a transaction. And then in between there's a DOF, or Device Observation Filter, which is an optional component that can provide an ability to filter floods of information that may be delivered from some of these types of devices. This profile is used for the provision and consumption of data. If a device has an observation that needs to be put into the patient's medical record for use in decision-making or research, this profile provides a common way of getting that information from the device to the storage application that would consume it. In each of these profiles, there's a series of transactions used. All of the PCD domain profile messages that we'll cover today, you'll see them consistently start with PCD, followed by a number to associate their purpose within the technical framework. Within this profile, for instance, PCD01 is a source message, and PCD02 is the response to that message. Our next profile in PCD is the ACM profile. If a device has an alert that needs to be addressed, this profile can be used for that purpose. This profile may be used for any alerts that require notification from the device, including patient-level alarms that need to be delivered, workflow step notifications, or advisory events about the device condition or status itself. This profile, once again, has three actors. The alert reporter. The alert reporter detects, synthesizes, and generates a notification based on the patient conditions at the time, being directly connected to the patient. The alert manager receives, filters, and directs the notification based on the content in the PCD04 message delivered from the AR actor. The AM will use its own configuration or information extracted from the message the AR actor delivers to determine what staff roles, groups, or individuals should receive a notice of the event. And then at the end of the point is the alert communicator, which is responsible for receiving and displaying the notification of the event to the recipient while providing a means of response for workflow purposes as well. Within this profile, PCD04 is a source message for an alert and is qualified and then generated by the AR actor. When the AM actor receives the PCD04 message, it can optionally provide a PCD05 response for status updates as part of the event. Should the AR actor need that for reporting and logging of the feature, they could collect that. Now, this does not eliminate the need for an HL7 ACK message or simulate an HL7 ACK message, but rather provides an ability to update status to the source system, such as accepted, rejected, canceled. so that the system can take appropriate action or store that information for reporting. The AM actor, in order to collect that information, is going to be sending that to an AC. The AM actor produces a PCD06 message to deliver the message for display on the AC actor. That would be an endpoint smart device or other device. The AC actor can then provide status updates back to the AM for use in alert escalations, reporting, or logging through the use of a PCD07 message that they would deliver back for each one of those status updates. This profile can use these transactions to support all phases of the alert process from start to end. Point of care infusion management, or PIV, is another profile. This one provides consistent method to improve the safety of infusion order processing. Implementation of this profile adds a sixth right to the typical 5 rights approach of medication administration we see out there in the field today. You can see this in the yellow. That step being ensuring the right device is being processed as part of those steps. Information is passed down between the infusion device and the programming system for confirmation that the device is programmed correctly for the order to be executed. The benefits of this would include better safety in the association of the device and a better record of that device association for records keeping as well. Now, after programming, as the infusion is occurring, whether that was programmed manually or automated fashion through a PIV, as we just showed, you do need to get the information on pause or resume or other parameters that can be considered as a progress update into the patient's record, or at least into the device's record in some cases. These very commonly go to a bedside medication administration system, BCMA for short, or directly to the EMR for viewing and validation for process. For those transactions, we use the PCD03 message type in the infusion pump event communication, or IPEC protocol, or profile, I should say. Implantable device cardiac observations, or IDCO, handles updates of implantable devices such as a pacemaker or a implanted defibrillator. These are typically done through gateway devices that a patient will connect to at different times of the day, and those updates will be sent out from those gateways. So these gateway devices normally connect back to a corporate server, capture raw data from the implanted device, and then pass the information via XML or some other proprietary format to servers for those gateways that they may connect to. Those gateways can then process these updates through a standardized format out to the patient's record in the EHR via these IHE message types. The messages are similar to that of the deck profile, which we discussed earlier. They're just coming from a different source to communicate their information. So, if the device that was being used and capturing the information was only sent for storage, if all the data it was processing was sent for storage, it would not be able to be called back at any point in time for usage for any of the systems that require it. So for scenarios where data callbacks needed, PCD does provide the retrospective data query profile, or RDQ, which allows for that data that was stored in a central server to be called back using specific time and patient parameters for specificity. As you can see here, we've got a PCD12 and a PCD13 for request and response messages, and those can be used in these types of transactions. With many devices such as physiological monitors and ventilators, waveform data can be included as part of the data they process. The Waveform Content Module, or WCM, provides a standard for inclusion of this data within both the DEC and the ACM profiles. WCM extends the DEC and ACM profiles to pass near real-time waveform data, and it does this using the HL7 version 2 message type. This waveform data can be sent down in two different forms. It can be sent via a live streaming waveform that can be provided through constant updates, or content can be recorded into a waveform snippet for including of a snapshot of the patient waveform at the time of an event in an update to the patient's record. This can be added to the patient's record historically, or it can be added into clinical content for outgoing notifications for covering staff. Using WCM, remote monitoring of the patient's waveforms can be accomplished via workstations or via smart mobile devices. So moving on from the patient relationship and events onto the management of equipment itself, we have the MEM-DMC and the MEM-LS profiles, or medical equipment management. These profiles produce information on device status, like charging, charge level, etc. Device location or device availability, such as an example, is a device assigned to someone, or is it not its location, or where is it currently? Combining these data elements that are collected from these profiles, we can consistently drive important queries for some of those common questions. Where can I find an available device? What's my idle rate for devices, and how much utilization of my devices are occurring? Do I need more inventory, or do I have a surplus of inventory? And from an asset management perspective or a loss prevention perspective, is the pump leaving the building in a possible theft? Availability of these data points drive clinical efficiencies and allow staff to quickly find the devices they need for patients on a busy floor and be notified immediately for problems with those devices as they occur in real time. The data also drives a better understanding of asset management needs for the facility and ensures notification of important events wherever needed. So while the proliferation of the devices that we're talking about, many of the newer ones are IP native or even have wireless connectivity, and that's constantly increasing. There's still a number of old devices in the field that use interfaces that are serial-based connections, and they use these for the purpose of data collection, and there's a hardwired connection to the back of them. These types of connections can lead to bottlenecks in the ways that they transmit data without proper management because they do tend to flood. So the optimized message syntax, or OMS profile, is intended to adapt IHE PCD profiles for devices that have slow legacy RS-232 serial ports that can drive this burst. OMS will optimize the PCD message to reduce the size of the message but maintain consistency within the mainstream PCD requirements. The result of that is more predictable and efficient transmission of the data between systems that still drives the content needed to make decision support while keeping the data small for records keeping purposes. And our last profile that we'll cover here is PCIM. The purpose of PCIM is to drive additional use cases and means for recording events from devices as they are associated with the patients. So this is a profile allowing systems to receive notifications of programming events as well as to query the state of patient device associations when needed. The profile creates a single authoritative source for patient device associations using 3 actors. The device-patient associations are done with the device-patient association manager. Recording associations are done through the device-patient association reporter. And reporting to association queries from other systems is the job of the device-patient association consumer. The primary benefit of this profile is really more efficient standards-based device-to-patient associations. Some of the enabling technologies in this profile include barcode systems or RFID tagging to assist in the identifications of patients, devices, or the staff that are executing on it. Secured identification of a device registrant as a system, a device, or a person that may be allowed to participate in that association. And it identifies a patient registration system as a system with the correct patient content that may participate in these associations. So To ensure proper conformance, this profile supports device association workflows utilizing HL7 version 2.7, and it does conform with US FDA UDI extensions, along with other profiles such as the Patient Administration Management, or PAM, and the Patient Encounter Management profiles. Those two profiles will be covered in the ITI domain presentations, since it's part of that domain, which are part of this webinar series as well. So our next topic here, getting away from the profiles themselves, is the NIST testing tools. The NIST testing tools, having all of these profiles without them going into it, would not be much good or really be useful without some assurance that they can be correctly verified. The National Institute for Standards and Technology, or NIST, partners with IHE to create independent and neutral testing tools. These allow us to verify proper operations and conformance of vendor-created solutions that use the profiles. These automated tools are available online for any profile implementers to test their conformance to the profiles and ensure that vendors can work with them in live implementations. The tools are also used for verification of vendor systems and the actors they support during our virtual testing each fall. That would be called the pre-Connectathon, and in live testing during the annual IHE Connectathon events that are happening each January. The messages PCD vendors produce and consume can be put into the tools, and we can see here a general path for the automated validation process within this diagram. A report is generated for each test vendor registers in their system that they're registering for, which can be copied by the tester for reference locally if needed, which can be useful. Each vendor will have a login to the test tool, so that's independent, and the information from each session can be stored if required for reporting purposes or for internal documentation processes. Storage allows for the information to be used later to improve the tools as well, or improvement of the profiles themselves in some cases as the information is provided. So next we have a list of our planned activities for this year. As part of the annual presentations, we'd like to provide status updates on the technical work the domain is doing or planned activities we intend to undertake. Each year the domain has particular efforts we pursue that help to further promote standards-based implementations with a goal to solve problems observed in the clinical community. Many of the problems we look to solve are complex and require multiple vendor solutions working together to drive proper outcomes, and this endeavor really is what the IHE is perfectly suited for. Here we've got some examples of our planned activities for this year, and I can describe in basic some of the expectations around those. So the PCD domain currently is partnering with the Fire Structured Data Capture, or SDC, working group on the Quiet Hospital initiative. This multi-vendor and multi-domain effort is combining Fire and HL7 2.x capabilities to leverage both current and new standards together. The combination of these profiles with the new innovations that we're driving will create further diminishment of alarm fatigue for patients and for the clinicians that are providing their care. We're involving other organizations outside of the IHE in this effort. Those include ECRI and HIMSS themselves, with more potentially being added as the effort progresses. Initial testing of systems associated with this effort is going to take place at the 2020 North America Connectathon this coming year in January, and the results of these efforts will be conveyed in demonstrations that we're planning for market feedback at the HIMSS 2020 Interoperability Showcase in Orlando. The IHE PCD domain is also combining this year with the Personal Connected Health Alliance, PCHA, to better coordinate standards for high acuity home health care and personal health monitoring devices. The PCHA, which covers this area, they're a HIMSS innovation company. They are working to advance patient and consumer-centered health, wellness, and disease prevention through the interoperability of devices that consumers carry every day. These efforts have similar objectives to those in the high and low acuity care environments that PCD supports today, Better connecting these groups is going to allow for us to be improved in our definition of use cases and more unified device communication standards as well. The PCD working group will be meeting jointly with PCHA this year in October for our face-to-face discussions, and next steps in this process will be discussed then. Some other notable updates. Expansion planning for multiple profiles is ongoing right now, with designs to include nurse call, lab results, radiology, and some workflow management conformance into the ACM and other profiles. Domain leadership is continuing to utilize opportunities to provide comments and guidance to federal standards directives for alignment purposes. This has been the case this year with the FDA discussions surrounding the Quiet Hospital Initiative and in partner with the Fire SDC Working Group. Updates and input to the IEEE 11073 standards for nomenclature across the systems will be continued through member representation in the IEEE. We have a couple of members on our domain that are part of that, and that's to ensure proper coordination of the standards as they're formed. To that effect, we have plans for additional terms and observations of events and attributes from the MEM-DMC and the MEM-LS profiles this year, as well as a general roll-up of alarms and events planned to go in. So any standard would not be a standard, of course, without participation and contributions from many vendors that provide products to the market. We're constantly looking to expand participation in IHE standards from market vendors to drive them to be more useful and to continuously improve the way that healthcare communication is handled. Try to make it in a way that works for everybody. For healthcare vendors looking to participate, the actual effort involved really is small in scope and can be extremely beneficial. Below we got a list here of what we ask of our committee members. Becoming an IHE member and participating in PCD efforts really provides a chance to bring new solutions to the table for review, plus review, participate, and vote on changes coming from other folks in the industry. As a member, we're all evangelists of the IHE standards, driving support for them, for those standards within our individual organizations, and also encouraging new vendors to join the effort while we're at it. Participation in IHE testing events and promotion of integration statements from the results of our mutual customers drives confidence in interoperability across the vendors, since we can prove that conformance through the joint testing that we do. And the opportunity to participate in IHE demonstration events, such as the HIM Showcase, allows for all the vendors to show how the standards make a difference in a cooperative and realistic healthcare environment or scenario. At the IHE, we promote and strongly encourage participation in the committees from healthcare organizations as well. Many of the activities are the same for consumers of the profiles, such as the healthcare provider, but the input to the profiles can have an even greater effect when coming from experienced clinicians. Organizations participating in the IHE have the ability to see new capabilities or value coming down the road, which can drive more efficient and cost-effective development of solutions in the enterprise, a real advantage for any provider to be able to see these technologies coming and plan for them ahead of time. And these organizations also have the benefit of input into the design of the profiles that will ensure strategic fit for the healthcare institutions as they move forward. Input from consumers of the IHE profiles represents some of the most important information that drives our standards, and as such has extremely high value to the domain in general. We're always looking for more organizations, so if you think you'd be interested, please reach out and we can help you connect. So a few cleanup notes toward the end here. The IHE PCD does maintain a list of commercially available devices and systems. These are updated on a quarterly basis roughly, and all of those systems can be found at the link provided within this slide. We do constantly update that, and we try to keep it fresh on a per Connect-a-thon and beyond basis. Additional resources, the PCD website, of course, will allow access to all of the information on the technical frameworks. And then we have a wiki, which has a wealth of information on the profiles, and then all the tool websites for pre-Connectathon, the Connectathon itself, and Rosetta terminology, which can all be useful in development against the profiles for those that are interested. Some contacts here. We have myself. I am a planning committee co-chair. Kurt Eliason with Smiths Medical is my fellow co-chair. We keep 2 co-chairs at a time for the domain in both the planning and technical areas, and all of those are listed here. Paul Sherman with ACE is our organizer for the domain, and then we have some links to the IHE PCD domain and IHE.net. For those looking to consume Connectathon results, all of the results from every year of the Connectathon are posted each time we have one, and they are available historically at the IHE Connectathon results site, which is the link at the bottom that's been provided. So I'll end the session with a summary of our profiles here, just for general viewing. And I want to thank everybody for coming in and joining the presentation today.
Thank you, Rob. Did we want to allow folks to ask questions if they had any?
We can allow for a few questions if, from a planning perspective, I should be able to answer.
Okay, sure. If anybody has any questions, go ahead and unmute your line and ask away, or you can send a message in the chat. And if not, then you can send any follow-up questions to secretary@IHE.net, and we will make sure to pass them to the appropriate PCD representative.
Okay. Thank you, everyone.
Thank you, Rob. Thanks, everyone. Enjoy the rest of your day.